I want to thank everybody for being here this morning as we get the meeting started. Apologize for running late due to our session just ending. So with that, I want to go ahead and make an opening statement. First of all, I want to thank Assemblymember Cooley for joining me today in seeking solutions to the inability of California's 911 system to accurately locate callers who use wireless cell phones in an emergency. The lack of reliable location data for these calls has resulted in many Californians being denied timely emergency medical care, law enforcement assistance, or fire department response. This situation is unacceptable and must be remediated soon as possible. The lack of a 911 cell phone location data has been a contributing factor in the deaths of injuries of many people in California. At least 4 members of this committee have had members of their local communities die because the 911 system could not locate them because they called from a cell phone. In other instances, the lack of location data has caused delays in callers receiving care. Studies have shown that even a minor delay in receiving emergency medical care is associated with adverse medical outcomes. The 911 system is a legacy system that was created starting in California in the early 1970s and was developed for use with landlines. The system has not fundamentally changed since then. Even the funding mechanism for the 911 system that was passed in 1976 has stayed with the same with only minor modifications. State 911 operators were and continue to be funded by a surcharge on user interstate calls of between 0.5% to 0.75 of 1%. The original 911 system that was created for use with landlines works well for landlines. A call made from 911 from a wired or landline phone would generate that exact location or address of the caller. The Public Safety Answering Point, or PSAP, dispatcher will be able to send fire, sheriff, police, or other ambulances to the call's exact location. Calls made from wireless devices such as cell phones do not automatically generate the caller's exact location. The problem arises because California has tried to adopt the 21st century technology associated with cell phones to a legacy system originally designed and developed for use with landlines. Today's 911 system, as applied to cell phone use, is nothing more than a Frankenstein's monster. We have taken a system that works well for landlines and tried to graft parts on and use Band-Aids to make it work with a totally different technology. The result is a system that often responds slowly, is unable to identify accurate call locations, and sometimes fails in its ability to dispatch timely response for assistance. Even more problematic is the decreasing use of landlines in favor of cell phones. According to the National Emergency Number Association, or NENA, about 45% of all U.S. households are now wireless only, and this number is increasing. The Federal Communications Commission, FCC, has stated that more than 70% of 911 calls nationwide now come from wireless cell phones. And it has been reported that in 2014, 12.4 million, or 63% of California's cell phone calls to 911 didn't share any location data at all. The FCC and the nation's 4 largest wireless cell phone carriers are trying to address the location issue. In January this year, the FCC federal rule was issued that requires carriers to steadily increase the percentage of cell phone calls to 911 that transmit location data. The updated order asks carriers to locate 40% of all callers accurate to within 50 meters or of a precise dispatchable address in the next 2 years. That percentage is set to increase incrementally, tapping out at 80% calls by 2021. Wireless carriers can now generally provide latitude and longitude information for cell phone calls, but are limited in more specific location data that can be provided to 911. When you call 911 from a wireless cell phone, the signal first goes to a cell tower, which may not be the closest tower to you. The call is then sent to a 911 PSAP in the cell tower's jurisdiction. At this time, the dispatcher can generally see the location of the cell tower your call is coming or is connecting through. After receiving the cell call, the 911 dispatcher system can transmit a digital request back to the wireless network asking for additional information on the cell phone's location. If possible, the wireless network will use GPS to locate your phone. This process can take seconds, minutes, or not even happen at all. This is the reason that one of our first questions asked by a dispatcher is, what is your exact location? Smartphone applications that have location ability like Google Maps have better location accuracy because they leverage Wi-Fi hotspots, cell towers, and Bluetooth signals to pinpoint a user's location. Unfortunately, wireless carriers and the 911 system do not have access to this more comprehensive technology. The data cell phone providers give to 911 dispatchers comes only from GPS satellites. This reduces the accuracy of location information. Anyone with a modern smartphone knows precisely where they are using one of the mapping apps. Using these apps allows us to identify the exact location of where to pick up a pizza or the location of family and friends. What most cell phone users do not realize that their cell phone does not have the capacity to share the location information with the 911 system. As more carriers send only GPS coordinates to 911 dispatchers and more of these calls start indoors where GPS satellites have difficulty accessing signals, the percentage of emergency calls, including accurate location data, has fallen rapidly. California is now preparing to adopt the state's next generation 911 plan, a statewide upgrade that would transform the way technology works and improve the way information is being received. It will give a caller the ability to send to 911 pictures, video, and text messaging. It is also intended to have intelligent routing calls so that calls may be directed to the closest dispatcher center. The state will have to fund these efforts, which some experts estimate could cost between $300 million to $500 million, and that could take up to several years to complete. In the meantime, the lack of accurate location information placing Californians who use wireless cell phones calling for aid from the state's 911 system is at risk. A 2-year target of 40% and a 6-year timeline for 80% accuracy is totally unacceptable. California should do everything it can to ensure that cell phone accuracy happens sooner, not later. We are holding this hearing to ask the question, how can we ensure wireless cell phone accuracy sooner than later? We are here not to point the finger or lay blame. We want to know, where should we go from here? What needs to be done to assure location accuracy? What are the costs to implement change? Is funding adequate, or do we need to reassess how we fund the 911 system? We will hear from the agency responsible for the 911 system, the Office of Emergency Services. We will hear from the wireless industry, from police, sheriff, fire departments, and the California Highway Patrol, PSAPs, emergency agencies, local governments, and others. I want to close my opening remarks by relating the story of Michelle Myers, 26 years old, who was found dead in her San Bernardino apartment on Monday, July 21st, 2014, after calling 911 to report her injuries. The City of San Bernardino Police Department received a call about 11 p.m. that night, but due to her inability to talk on her exact location, it took the police department over 20 minutes to locate her by the longitude and latitude information that was given. When they finally narrowed down the area, searched an apartment complex where she was located, unfortunately she was dead due to her injuries. She survived. So that is just part of the reasons why we're here today, to see how we can better understand the system and how we can make it work, especially in a time of an emergency. So with that, open up to my colleagues that have joined me to see if they want to have any opening remarks as well.
Thank you, Mr. Rodriguez, and thank you for holding this hearing. The issue of 911 location accuracy in cell phones is one that I've worked on for several years, but it is like peeling layers of an onion of information. People die if 911 calls are not accurately located. This has been the result in my district and elsewhere too many times. And in fact, we don't know how many times, because there's not all the information concerning that it can be forthcoming. An emergency response system should start with routing of 911 calls to the law enforcement agency that is best able to dispatch responders. Many times that is not CHP. Unfortunately, even this simple step is not functioning properly, as most of the cell towers of the state are continuing to be routed to CHP, and there is not a statistical analysis on 83% of those towers to see if they really should be still routed to CHP. This simple step is not functioning properly. To have an intermediate step, which requires sending the call somewhere else for no appropriate reason, only to be sent back, at best introduces delays and frequently results in tragedies. I've had many meetings with the department, my local public safety responders, and telecommunications companies, and it is still unclear to me why, when we have the technology to ensure accurate routing of wireless calls to the appropriate PSAP, we don't utilize that technology, and we don't utilize the data that we already have over where these calls are destined to determine what the best location for routing these calls should be. It's the state's responsibility to bring the 911 system into the 21st century and provide reliable, accurate location information. We have a responsibility to the constituents of California to preserve life and public safety, and we are not doing enough to do that.
Assemblymember Cooley.
Freddie, I just want to thank you for convening this hearing. The issue of how our 911 system works is very vital. It's an interesting area because actually in the day when it was established, it was a breakthrough system. It utilized the best technology of the day, but we know technology, we become sort of time-bound. And so you always have to be looking at where's the point where you can upgrade things. It's interesting as I sit here, although admittedly 20 years of my experience was in the private sector, Saturday is the 38th anniversary of my doing legislative work. And really when I think back across that time, the essence of this process, the way we move our state forward in any area, is sort of what I call the leadership syllogism. On any given issue, here's where we are today, which is bad for the following reasons. Here's where we might be tomorrow, which would be an improvement in these specific respects. Here's how you go from A to B. And I just feel, this is a very important hearing. It fits squarely within what I see as this way we move our state forward. The tragedy is, I'm interested in seismic issues. I'm in my second stint on the Seismic Safety Commission. I was involved in the legislature's response to the Loma Prieta earthquake. In the earthquake area, we sort of are in a position where the best thing you could have with you from a safety standpoint in an earthquake is a whistle. So if you have the tragic circumstance of being trapped somewhere, you have that to make noise and bring people to your attention. The fact is we have found that because of deficiencies in the 911 system, not just here but nationally, we hear stories out of Katrina where people were aided because somebody was on their shortwave system in Portland and got a roundabout notice that there was someone trapped in a facility in New Orleans. So there's just a need for us to figure out, okay, here's where we are today, which is bad. You don't have to point fingers. It's technology changes. But how do we come up with the resources to safeguard our population from what we know are known hazards? And so I want to thank you very much for this hearing. As I shared with the chair, I have a meeting related to a bill of mine with a couple of my colleagues. I need to go join briefly, but I will be back. But I think this is the sort of hearing we need to be having. I thank you. And of course, your background in public safety, emergency responses gets us here. Thank you.
Thank you. Assemblymember Manshine.
Thank you very much, Mr. Chairman, for taking on this incredibly important issue, and thank you to my colleagues who also care very much about this and certainly are committed to working on this issue. Our 911 system is aging, and it needs to be closely examined to determine the best way to incorporate the cell phone technology most of us carry with us all day. Cell phones have become an integral part of our lives, and in fact, more and more people are only using cell phones and canceling their landlines. Therefore, calls from cell phones in a time of emergency are significantly increasing each year. It's extremely worrisome that using a cell phone in times of crisis may lead to a disastrous delay in emergency services reaching the scene. The ability to be located by 911 dispatchers in a time of emergency is an important issue across the state, but it's also one that hits very close to home for one of my constituents, Linda Leong. I'm glad you will have the chance to hear Linda's powerful story, which she will share for us today. I'm glad she brought up her children as well. And I look forward to hearing how OES, wireless carriers, and emergency services can collaborate to improve the 911 system and avoid future preventable tragedies. Thank you again for calendaring this and for having this hearing.
Thank you very much, Assemblymember. Assemblymember Cooper, would you like to share any comments, opening remarks?
No, thank you, Mr. Chair. I apologize for being late, but we had a leadership meeting after session. I'm just excited to be on this committee. I think there's a lot to get done. For my city, Elk Grove, which I used to represent prior to coming to the Assembly, we were the first city in the region to take the 911 transfer calls from CHP for mobile cell phone users. So there's a lot of good, hard work to be done. I'm looking forward to hearing from the experts in the industry.
Thank you very much. So with that, we'll go on to a Rawson report. On February 23rd of this year, the NBC Today Show aired a program titled "Some 911 Systems Can't Find You in Emergency Due to Data Technology." We have somebody from NBC, I believe, that would be here today, or we have a video. We have the permission for NBC to play it, so it's a brief report that they showed here in February. So with that, we'll